Hello, I'm Dr. Stephen Blomerth, and welcome to Natural Health Today. This show is dedicated to your questions, your concerns about problems that you may be having yourself or with a family member. And what we do is we invite you to participate in the show, send in your questions, because we will talk about some natural health means to help you get better. And by natural health, I think of 4 different avenues that go into natural health. One is manipulation of joints that are stuck, because joints that are stuck may not necessarily hurt at the time, but they set up an alteration in your normal mechanics and normal nerve flow that can result in you having pain a long distance from the site where the joint may be stuck. So freeing up stuck joints can be a very powerful tool to help you get better. Another way of helping people get better is muscle work. Muscle work can be involved with tight muscles or painful muscles, or even sometimes what we call muscle trigger points that have far-reaching effects across our body, because there's webs of muscles and also the connective tissue that surrounds these muscles that starts at the base of our foot and goes all the way up to the top of our head. So muscle work can be very important too, and I'm not talking about just getting a massage. A massage is okay, but it's not really a way of solving some problems. I'm talking about a little bit more accurate work on muscles that have problems, and also giving special exercises to people who have problems. The third way that we help people is with exercise. Exercise is not only say cardio or conditioning and stretching. It's actually working certain muscle groups that tend to be weak while we stretch muscle groups that tend to be too tight. And probably the best way I found in my 37 years of practice of doing this is giving guided foundation training exercises. We'll talk about that at a later time. But exercise is a very important tool in getting better. And the last avenue that I think of when I think of natural health is nutrition. Nutrition is probably the slowest means, but probably the most powerful means over time for you to guard your health, protect your health, and keep you from having problems that you otherwise wouldn't necessarily run into. So those 4 avenues are what I call natural health care, and I invite you to participate by sending in your questions that you may have about aches, pains, improper digestion, all the different things that can go into keeping a person healthy. You can send in your questions to our email address, which is pbdchiropractic@gmail.com, or you can call in your questions to my office at 978-535-6155, or you can even send an old-fashioned handwritten snail mail letter to my office address, which is 215 Newbury Street, Suite 102, Peabody, Massachusetts, 01960. But whichever way you decide to participate in our show, we'll slightly disguise your name so your friends and neighbors won't know who it is that sent in a particular question. And then we'll talk about ways to help you. And if we don't think there's any natural means of helping you, we'll tell you that too. But it's a lot of fun to get some interaction with people and talk about ways to help them, because I'd say 80 to 90% of the day-to-day nuts and bolts basic problems that people have, they don't require drugs, they don't require surgery, they just require the right program to get better, and that can usually be solved by the 4 avenues I just mentioned as part of natural health care. So let me put on my reading glasses. We'll look at some of the questions that have come in since our last episode. Okay. Our first question is from Jamie. Jamie writes in from Danvers. She says, I had to have my gallbladder removed a few weeks ago, and they took a CT scan of my back to check out my gallbladder. In that study, they found I have a compression fracture in my lower back, and I have some disc bulges. My primary care doc told me not to go to my chiropractor anymore, even though when I go, I always feel better. Should I buy one of those inversion tables instead? So let's just reiterate what Jamie told us. She said she recently had some gallbladder surgery, and when they do gallbladder or internal organ types of scans, sometimes they'll incidentally, so it sounds like in looking for her gallbladder, they incidentally found some things wrong with her back. And it says she has a compression fracture in her low back and some disc bulges. And so her primary care doctor told her not to go to a chiropractor anymore, even though she always feels better. So she's asking, how about one of these inversion tables? Well, first of all, let's just mention, what is an inversion table? Inversion table is a device that people can buy, and it tilts them sort of halfway upside down. And by tilting them halfway upside down, what it does is slightly reverses the gravity, and it would give a certain degree of traction on your spine. Is that the equal of a good chiropractic adjustment or manipulation? Certainly not. And the question that I say to everybody who wants to consider inversion table is our body designed to be upside down? Our body isn't really designed to be upside down. Now, I know it's only briefly, but all our blood flow is designed to go up to our head, not have all the blood flow being forced up into our brain by being in an upside down position. So I think those types of devices like inversion tables have little place in day-to-day healthcare, and certainly not as a good substitute for chiropractic care. Now, why would her primary care physician say, don't go to your chiropractor anymore? Well, unfortunately, it dates to problems that should have long been put to rest, because the medical doctor does not know what chiropractors do, has no idea. Whereas chiropractors know very well what medical doctors do, but the reverse, unfortunately, is not true. Any well-trained chiropractor who learns that a patient has a compression fracture in their spine and/or disc bulges is going to alter the type of care that they give to a person. You don't give the same care to a healthy adult who is 20 years old as you'd give to a baby who's 20 months old, or as you'd give to a person who is, say, 80 or 90 years old. You tailor your care to the situation for that person and what you know about any pathology that person has. Would you treat them all the same? No, you treat them differently. So the thing that Jamie said that was most telling to me was she always felt better. So if she informs her chiropractor or has the films sent or just the radiologist report sent to her chiropractor will be able to take that into consideration, alter what he does with Jamie. And the important thing is, if she's always felt better when she goes to chiropractor, why take that method of keeping her healthy away from her? If it's always made her feel good, she should probably continue to go, because it's helped her in the past and will continue to help her in the future. But some slightly different techniques would have to be used so as not to disturb the compression fracture. The thing about bulging discs are very, very common. Many people have them. In fact, they did a study years ago. They took 100 people off the street who had absolutely no pain, did MRIs of them, and found that 50% of them had quote-unquote bulging discs. So people who have no symptoms can often have a bulging disc, and so it's not a particularly fruitful finding. It could be a reason why a person might have pain if the bulging disc pressed on a nerve, if the bulging disc pressed on the spinal cord. But if it just says bulging disc and doesn't mention that it's pressing on a nerve or spinal cord, there's no reason that judicious chiropractic care can't be given in that area to help Jamie continue to feel good. So Jamie, I don't advise inversion tables. I advise you inform your chiropractor, get some of your records sent over from your medical doctor. I know when you're getting over having gallbladder surgery, you can be pretty tender and probably have some muscle groups that have some knots and some trigger points and muscles. Getting some work at this point in time will probably help you feel better from your gallbladder surgery. and continuing to get chiropractic care, particularly where it's helped you in the past, is wise, as long as you inform your doctor of the findings that the other doctors found. So, Jamie, thanks for that question. Let me put my reading glasses back on, and let's go on to our next question. Okay, Rick is from Middleton. He writes in, I had a checkup last week, and they found that I was anemic. I looked up some diets to help me with the anemia, and a friend said that one thing I should change is not taking so many Tums and getting off the Tagamet I take. What does that have to do with anemia? I thought anemia was about not getting enough iron. Well, Rick, anemia has several different causes, and only one of them is not getting enough iron. What is anemia? Anemia means you don't have enough red blood cells, or it means that the red blood cells that you do have aren't picking up enough oxygen. And the reason that they can be not picking enough oxygen is they might not have enough iron, because iron is the portion that's in your blood cell that forms something called hemoglobin. Hemoglobin is kind of like an oxygen trap. You might think it, as a molecule like this, and when hemoglobin gets in an area like your lungs, where there's a high levels of oxygen, the hemoglobin molecule kind of traps and holds onto an oxygen molecule. And then that red blood cell in the hemoglobin rides off to another area of your body. And in that other area of your body, if there's low oxygen concentrations, the hemoglobin opens up and lets go of the oxygen, so the oxygen can go to the areas that it's needed. So if you don't have enough iron, you won't form enough hemoglobin, and that can be one of the definitions of anemia. But you also might not have enough of the red blood cells in general. Even if you have enough iron, you might not just have enough cells. One of the reasons why people may not have enough cells is they may not have enough vitamin B12. Vitamin B12 is important for the maturation of the red blood cells. And unfortunately, vitamin B12, sometimes people don't eat enough or they don't absorb enough. So you can eat vitamin B12, but you might not absorb it. Well, what prevents you from absorbing B12? Not having enough stomach acid. So if you take a lot of Tums, or if you take antacids of any sort, like there's many different brands out on the market, like Tagamet, Pepsid AC, there's many different brand names. But just doing something as simple as eating a lot of Tums every day of the week, you will have less stomach acid. If you have less stomach acid, you won't make enough intrinsic factor. If you don't have enough intrinsic factor, you don't absorb the vitamin B12. So if you're having anemia, it is probably good to perhaps add some foods that have some iron in it. That's probably the best known way. But also make sure that you don't have too much antacids, like Alka-Seltzer, like Tums, like all the things I just mentioned, because those will cut down on your ability to absorb vitamin B12. Both vitamin B12 and iron are crucial elements in your nutrition that allow you to produce not only enough hemoglobin to go inside the red blood cells, but also just enough red blood cells in general. So thanks for that question. And I hope you feel better and get your problem straightened away. Because being anemic, will make you feel tired and run down, have a hard time climbing stairs. Okay. Phyllis writes in from Beverly. She says, I have a problem that's been going on for years. One week I get constipated, so that I have to take something because I get too bound up. I get too bound up to go. And then after I take something, I get diarrhea so that I can't hardly leave the house. I've sort of learned to live with it, but all my friends say that it can't be healthy. What do you think? Well, do I think that alternating constipation and diarrhea is healthy? No, but there's many, many people who live that way. And just because many people live that way doesn't mean it's a healthy situation. So what can be the cause of it? Well, there's many things, but probably I'd say the simplest thing is not getting enough fiber in your diet. And I'm not talking about taking fiber pills or taking Metamucil or different things that supposedly have bulk. It's eating right. And I'm talking about, eating enough of foods that have fibers, basically vegetables. Now, vegetables aren't the only source of fiber, and there are two different types of fiber. There's soluble and insoluble fiber. But fiber can be found in vegetables. Other types of fiber can be found in fruits. Still other types of fiber can be found in grains. The best way to get them is not through a fiber supplement. The best way to get them is through your food. I know many, many people eat like this. They'll have a big piece of meat and maybe one or two little strands of vegetables on their plate. If you want to be healthy, it should be the other way around. A big plate of great vegetables and a few little pieces of meat. So most people eat in the reverse way. They eat far too much protein and not enough vegetables. We really need to, get vegetables more in our diet. That will keep our gastrointestinal tract moving along so you don't get bound up. Because once we start taking drugs to help us loosen up our constipated bowels, then oftentimes, like Phyllis, they move too much. And when they move too much, then you get that type of diarrhea where you can't leave the house. And then sometimes people take other drugs to stop the diarrhea. So they're constantly stepping on the gas, tromping on the brake. With your car, if you try to drive your car all day long by hitting the gas hard, tromping on the brake, that car would break down. Same thing with your body. Your health will not continue to be good and give you the type of energy and life that you want to live if you're having alternating constipation and diarrhea. How do you find out? Well, at least at my office, we give the people this 2-page dietary diary, and they just write down what they have for morning meal, afternoon meal, evening meal, and what they have in between. And we follow them just for a week. After a week, you kind of get a sense of how that person is eating. Because one meal a day, who can remember what you ate the day before? You probably can't remember. But if you keep a little tabs on it by writing things down, it not only will give me a better idea what you're eating, but sometimes once you see it written down, you say, oh, look at that. People will learn sometimes, about their own trends that they had never seen written down before. It takes a little time to do it. It takes about a week to do a dietary diary, but it can tell you a lot of information. Once I know that type of information, I know what to recommend. But I can recommend across the board, eat more vegetables, perhaps eat a little bit less meat. And if you do tend to be the type of person who gets constipated on a regular basis, I can say one food in particular to avoid is going to be cheese. Cheese and dairy products in general tend to bind us up. So stay away from that. And particularly if you're interested in losing weight, cheese is not a good thing to eat in order to lose weight. So thanks for that question. Dietary diary is probably the best way to delineate, what you're taking in. And alternating constipation, diarrhea, a bad way to live. Okay, let's go on to our next question. Okay, Roger writes in from Danvers. He says, I've been taking music lessons the last year, and I'm learning to play the bass guitar. It's a lot of fun, but after I play for a while, my left shoulder gets really sore, so I have to stop. My music teacher said it could be trigger points in my muscles, but I have no idea what that is, how to get rid of them. So what are trigger points? Well, it's interesting that his music teacher is aware of it, because a professional musician who's playing all the time is going to learn all the things that they can possibly do to not develop trigger points when they're, or any type of soreness, if they have to play long periods of time, like a teacher would have to play long periods of time, or a performer would have to play long periods of time. So I'm sure Roger was already advised by his music teacher about the right weight and size of his instrument and the right shoulder padding. But I'm going to put up a little chart and try to show the camera what trigger points look like. This is a partial list of some of the trigger points that people can have. They can occur up in your head. They can occur different areas of your body. This is an interesting one over here. This one over here is showing a trigger point in your trapezius muscle. So the trapezius muscle is a large muscle that's up in your shoulder area. But as you can see in this drawing right here, the hallmark of a trigger point is it doesn't necessarily even have to hurt here, but it can refer pain. If you see that whole area, that orange area, that's the area that the trapezius trigger point. It can even go over here to above the eyebrow. So a trigger point is more than a sore muscle. It's not the same as having a bruise in a muscle. It's having a site in a muscle that is more tender than you would think. If you press on a muscle that's been hurt or bruised, yes, it's going to be sore, but a trigger point is sore and painful out of all proportion, and it usually radiates. You can probably see trigger points all across here. They show radiation of pain. So you may not even have soreness in the muscle, but the pain will radiate to different locations. I'm going to put away our little chart. I think we've seen enough of what trigger points look like. How do you get rid of them? Well, many times trigger points are latent, because almost all of us have trigger points in muscles because we do certain things a lot. We might sit at a computer a lot. We might sit down a lot. We may have our head down in this posture like this, looking at our cell phones. We might do some activity over and over again. It can mean that we develop soreness in the muscles, but beyond soreness, the trigger points are areas, they're tight, they can be tender, but they usually evoke uncharacteristic pain. So you know if you press on yourself with a given amount of force, you'll say, well, I feel a certain amount of tenderness from pressing on the area. A trigger point lights up, and you press on it a given amount of force, and it'll say, what the heck? That is surprisingly tender. Either tender or the pain will radiate not only from that site to other sites. And they can, like there are trigger points in the back of your shoulder blade that can refer pain all the way down into your arm and into your wrist. Will they go away? They will not go away. They will, like if you hurt yourself bumping your elbow or falling down a flight of stairs, something like that, and you develop a soreness in a muscle, you know that within 2 or 3 weeks, that type of pain will go away from an injury. So a trigger point is not necessarily an injury to a muscle. It's there because of repetitive use. Sometimes it's there because you've had muscle imbalances, because you've done a lot of exercises for one muscle group, but you haven't done the proper amount of exercises for the opposite muscle group. Trigger points, once they get started, they don't go away. What they can do is become latent. They may not actively hurt you, but they're waiting in there. So it's likely that Roger had some of these trigger points in his muscles before he started taking bass lessons, but the bass lessons were a new activity, a new slight strain that brought out the pain from the trigger points. How do you get them to go away? It's not so easy. It means you have to not only go to that muscle, and you have to go back and forth across that area to break up that knot. The knot actually has to be physically broken up. And then you have to do all you can do to retrain the muscles around it that oppose that trigger point. You have to not do exercises that make that muscle any tighter, and you have to eliminate the muscle imbalances that people have. Muscle imbalances is a whole study in itself, but a very common muscle imbalance is people develop too strong pectoralis muscles, which pull them forward like that, or their posture is bad, and the muscles that pull you back are weak, and you need to train the weak muscles, because training the weak muscles automatically stretches out and puts into better balance muscles that can have trigger points. Trigger points are a fascinating subject, and they're the reason why probably 70 to 80% of people have pain in their back, their neck, or headaches, because trigger points are latent in muscles, and then they become active when we do something that's a little bit different. We might be exposed to cold or do something a little bit longer or harder than we're used to, and we can have a trigger point go from latent to being active. So Roger, thanks for that question. It's a good one. It's a big topic, and trigger points are not, again, they're not just sore muscles, they're knots in muscles that are unbelievably sore. When they're pressed upon, they radiate pain, and they don't go away unless they're treated properly. So I'd like to thank you for watching Natural Health Today. I'm Dr. Stephen Blomerth, and what we like to do each episode is talk about your questions, your concerns, things that you would like to be discussed. We went over several different topics today, and we like to talk about natural health means to get you better. So if you'd like to send in your questions, you can send emails to pbdchiropractic@gmail.com. You can telephone my office at 978-535-6155. You can send an old-fashioned snail mail letter to my office address, which is 215 Newbury Street, Suite 102, Peabody, Massachusetts, 01960. Whichever way you choose to participate in the show, we'll slightly disguise your name so people won't know exactly what kind of problem you have. And we'll discuss natural health means of helping you. And if you can't be helped by natural health means, we'll probably tell you that too, because 70, 80, 90% of day-to-day healthcare problems can be helped by natural health means. It means you don't need drugs all the time. It means you don't necessarily have to run to the surgeon to get better. You can be helped by means that will help you and not hurt you. So once again, I'm Dr. Stephen Blomerth. Thanks for watching Natural Health Today. See you next time. Bye-bye.